Please take note at this very moment. 89% of Americans over the age of 60 are disregarding these warning signs, and this could end up costing them their lives. It is likely that you are ignoring the signs of aging or stress as the cause of the symptoms you are experiencing, but your heart is making a desperate attempt to communicate something to you. Your chances of experiencing sudden cardiac death grow by 12 for each day you choose to disregard these warning signs. I will reveal 13 warning signs that could save your life tonight, but you must remain with me for the next 15 minutes. Before we get stats and story, 6M+ U.S. adults have undetected heart failure. Margaret's pillow need gasping ignored as aging nearly cost her life. Started, however, I would like to ask you to click the subscribe button and enable notifications if you are concerned about your health. This is because it is here that we reveal the truths that no one else discusses. I would also like to know if you are with me. If you are watching now, if this video resonates with you, please type 1 in the comments section. If not, please type 0. You are unaware of how important your voice is. As somebody who works in healthcare, I was taken aback by the following. Currently, there are more than 6 million people in the United States who suffer from heart failure, and the majority of them are unaware that their bodies have been trying to send them warning signals for months. The moments you witness in films, in which people hold their chests in an over-the-top manner, are not the kind of moments being discussed here. 94% of the population simply overlook these subtle everyday signs, which are the ways that your body cries out for assistance. The information that I'm going to offer with you is based on decades of medical research and data from thousands of patient instances. The fact that certain warning signs are so particular that having knowledge of them might actually mean the difference between living and dying is what makes them so important. Other people are so prevalent that you have most likely encountered them this week and dismiss them as insignificant matters. I want to take a moment to tell you about Margaret, a 72-year-old who lives in Phoenix. It was 3 months ago when she began to require an additional pillow in order to sleep properly. She was of the opinion that it was simply a matter of personal preference for comfort. After that, she started waking up with a gasp, struggling to get air, but she attributed this to the anxiety she felt over her grandkids. She assumed that she was simply in poor physical condition when she began to feel short of breath while lacing her shoes. Margaret was suffering 3 classic early warning signals of heart failure, but like the majority of Americans, she disregarded them until it was nearly too late to do anything about them. The horrifying reality is that your heart will not wait for a convenient time to fail. Months before any crisis arises, it begins to send out distress signals. According to medical studies conducted by the American Heart Association, those who are able to recognize these early warning signals and seek medical treatment can prevent 90% of emergencies related to heart failure. For those who do not pay attention to them, there is a 50% probability that they will not survive their first significant cardiac event. It is important that I make it clear that the material that is contained in this document is for educational reasons only and that it should never be used as a substitute for seeking advice from your healthcare physician. With that in mind, let's get started by delving further into these potentially life-saving warning signs. All of the information that I'm sharing with you is supported by reputable medical research, and I will provide references to the relevant studies so that you can discuss them with your physician. If you or someone you know experiences any of these symptoms, particularly if they are experiencing more than one of them at the same time, please get medical assistance right once. We will now begin our investigation of the 13 warning signs that your heart employs in its appeal for assistance. Starting with signs in 1. Exertional shortness of breath, gasping after light tasks, stairs groceries, heart can't meet oxygen needs, rests longer than usual. The symptom that is most frequently misinterpreted and that affects millions of Americans on a daily basis. The first indicator that should raise concern is experiencing shortness of breath while engaging in tasks that were previously completed without any difficulty. This is not a discussion of the feeling of being out of breath after running a marathon or climbing several flights of stairs. We are referring to the sense of being out of breath when you walk to your mailbox, when you climb just one flight of stairs, or when you carry groceries from your car to your house. Your heart is attempting to convey an important message to you. If all of a sudden you find yourself struggling to breathe after performing tasks that have never been a problem for you in the past, this is what is now taking place within your body. Your heart muscle is unable to pump blood at a sufficient rate to satisfy the oxygen requirements of your muscle. When you are engaging in physical exercise, if it is weakened, you get a sensation of breathlessness because your lungs are overworking themselves in an attempt to compensate for the lack of oxygen. This form of exertional shortness of breath is one of the earliest and most dependable markers of developing heart failure. According to research from major cardiology facilities, this symptom is very worrisome because of the way it progresses. The majority of people adjust to changes in a gradual manner without even noticing it. You might begin to use the elevator instead of the stairs, park your car nearer to the entrances of stores, or ask other people to assist you with carrying heavy products. You justify these changes by attributing them to the process of becoming older, or to being in poor physical condition. But the reality is that your heart is truly calling out for assistance. According to medical research, this particular symptom typically manifests anywhere from 6 to 12 months prior to the emergence of any other noticeable indicators of heart failure. The amount of time it takes to recover is the primary distinction between the symptoms of heart failure and regular weariness. Healthy people recover from physical activity quickly, but if you find that you require long periods of rest following activities that you do on a regular basis, you should seek medical attention as soon as possible. It is possible that you will be surprised by signs in 2. Orthopnea, needing extra pillows to sleep. Breath, fluid backs up in lungs when flat progresses to recliner sleeping. The second warning sign because it occurs when you are attempting to get some rest. Orthopnea is the term used to describe the condition in which a person needs an increasing number of pillows in order to be able to breathe adequately when they are sleeping. This progressive transformation is considered to be unusual by a large number of people. This is because it develops over the course of months or even years, making it difficult to detect. The force of gravity no longer assists your heart in pumping blood back from your legs and lower body while you are lying down flat on your back. When your heart is weaker, blood starts to accumulate in the veins that are responsible for returning blood from your lungs to your heart. When you are in a prone position, the backup forces fluid to leak into the lung tissue, which makes it harder to breathe. According to research conducted at major medical institutes, roughly 80% of individuals who are diagnosed with heart failure at the time of their diagnosis exhibit symptoms of orthopnea. The progression is gradually and subtly deceptive. You might begin with 1 additional pillow, then gradually increase that number to 2, then 3. In the end, a lot of individuals discover that the only posture in which they can breathe comfortably throughout the night is while they are resting and reclining. The fact that people justify this change by rationalizing it is what makes this symptom more deceiving. They attribute it to allergies or sinus difficulties, or just believe that it is a matter of personal taste for comfort. Your cardiovascular system is attempting to communicate something really significant to you regarding the pumping ability of your heart. If you have transitioned from sleeping in a flat position to requiring many pillows or sleeping upright in order to breathe appropriately. Of all the possible warning signs, the third one is the one that is most likely. Signs in 3. Paroxysmal nocturnal dyspnea, waking gasping drowning feeling 2-4 hours after sleep. Fluid shifts to lungs mimics panic attacks. to instill fear in a person. It is most often experienced during the middle of the night. The sensation of drowning while lying in your bed is how it feels, and it is referred to as paroxysmal nocturnal dyspnea. You are jolted awake typically after 2 to 4 hours of sleep, and you gasp for air in a panicky manner as your heart pounds in your chest and you begin to worry. This phenomenon occurs when, after you have been lying down for a number of hours, fluid that has built up in your legs during the day begins to redistribute itself throughout your body, including to your lungs. This abrupt increase in fluid volume, which is overwhelming for your heart, which is already damaged, is causing you to experience extreme shortness of breath. This symptom is so severe that it jolts you out of sleep in a state of dread. The occurrences compel people to immediately go to windows or doors in order to open them, frantically searching for fresh air. Certain individuals have described their sensation as being similar to drowning or choking. According to clinical research, this symptom is among the most terrifying sensations for people with heart failure, and it frequently results in visits to the emergency room in the middle of the night. The fact that this symptom is so often misattributed is what makes it so particularly harmful. It is common for people to attribute these occurrences to dreams, panic attacks, or sleep apnea. Although these illnesses are known to cause sleep disturbances, the precise pattern of waking up gasping for air, particularly if it is occurring more frequently, constitutes a medical emergency that necessitates an immediate assessment. Of all the warning signs, number 4 is the one that is most frequently disregarded. Despite the fact signs in 4, extreme fatigue, everyday tasks, showering exhaust you, heart redirects blood to vital organs, starving muscle, that it has the potential to be the most incapacitating. It's an exhaustion so profound that even the most mundane of everyday activities feels like an arduous trip up Mount Everest. This is not the kind of typical fatigue that can be alleviated with rest. This is a fatigue that persists even when you get enough sleep, and it makes it difficult to carry out things that you once enjoyed doing. Your body will make a decision to survive in the event that your heart is unable to pump blood adequately. It redirects the flow of blood away from muscles and organs that are less essential, and it instead directs it toward more necessary sections of the body, like as your brain and heart. This results in a reduction in the amount of blood that is delivered to your skeletal muscles, which also reduces the amount of oxygen that is delivered to them. This can lead to severe exhaustion and weakness that can impact every facet of your everyday life. This symptom can manifest itself months before other more visible indicators of heart failure become noticeable. According to research that has been published in major journals that focus on cardiology, the impact that it has on both exercise tolerance and recovery time is especially troubling. These days you need to take extended periods of relaxation after going on a brief stroll, but in the past it would have invigorated you. Even the simplest actions such as taking a shower, making food, or climbing stairs turn into grueling or that leave you feeling depleted for hours afterward. Many people are unaware of the significance of the changes they make to their lifestyles. Since the process is frequently so gradual, they begin to abstain from activities, turn down invitations to social events, or invent reasons to avoid physical work. They attribute the issue to age, stress, or a lack of physical fitness. But this progressive reduction in stamina is indicative of your heart's battle to provide your body with the most fundamental requirements for oxygen and nutrients. Among the early warning signs that can be observed, warning signs in 5T, 6, edema and rapid weight gain, ankle leg swelling, pitting worsens daily, 2-3 plebs day, or 5 plebs week signals fluid retention, call doctor. Number 5 is one of the most conspicuous. Despite this, a large majority of individuals disregard it until it reaches a critical level. The medical term for it is peripheral edema, and it refers to swelling in your ankles, feet, or legs. This is not the type of puffiness that occurs as a result of consuming salty foods or sitting for an extended period of time. This is swelling that persists and worsens over time, particularly at the end of each day. Because of gravity, blood starts to accumulate in your lower extremities when your heart is unable to pump effectively, which is a result of the fact that blood is not circulating around your body as it should. Furthermore, since your kidneys are receiving less blood flow, they respond to this by storing both sodium and water. As a consequence of this combination, fluid is forced out of your blood vessels and into the tissues that surround them. This results in apparent swelling that can become fairly pronounced. At the time of diagnosis, peripheral edema is evident in around 70% of heart failure patients, according to research. In the most severe instances, swelling can begin in the feet and ankles and then proceed upward to include the calves and even the thighs. You may realize that your socks are leaving deep indentations on your skin, that your shoes are becoming tighter and tighter as the day goes on, or that rings that used to fit you well are suddenly feeling too tight. The pattern is of diagnostic significance. Swelling that is associated with heart failure typically occurs symmetrically, which means that it impacts both legs to the same degree. Additionally, due to the effects of gravity, this swelling tends to become progressively more severe as the day goes on. This is an indication that there is a considerable amount of fluid buildup that requires immediate medical attention if you apply hard pressure to the swollen region, and it results in an indentation that remains for a number of seconds. It is possible that warning sign number 6 is the most objective and quantitative early indicator of the development of heart failure. The weight gain is happening swiftly because of fluid retention, and it is occurring at such a rapid rate that it should be a cause for immediate concern. We are not referring to the slow increase in weight that results from overeating or the pleasures that are typical of the Christmas season. This is a rapid and dramatic increase in weight that can occur over the course of only a few days. This particular warning sign is described in great detail in the medical guidelines provided by the American Heart Association. If you gain 2 to 3 lbs in a single day, or 5 lbs or more in a week, it is important to contact your healthcare physician as soon as possible. This is not merely a suggestion. It is a medical emergency that demands quick attention in order to prevent the development of additional more serious issues. This rapid weight gain is caused by the fact that your failing heart generates complicated hormonal responses that lead your kidneys to aggressively retain salt and water. Roughly 1 liter of surplus fluid accumulates in various parts of your body for every kilogram of weight that you gain. Clinical research has highlighted the fact that weight gain frequently occurs prior to the emergence of other symptoms that are noticeable or troubling. Although you may not have yet noticed any considerable swelling or severe shortness of breath, the scale does not lie when it comes to fluid accumulation. Cardiologists frequently encourage patients who are suffering from heart failure to weigh themselves on a daily basis first thing in the morning and to report any abrupt increases in weight as soon as they see them. This is for this very reason. It functions as an early warning system that has the ability to prevent emergency hospitalizations as well as complications that could be fatal. The 7th warning sign is frequently confusing to individuals. Signs in 7-8, nocturia and nocturnal cough, frequent night urination. 3-5, dry cough, worsens lying down, frothy mucus, fluid redistribution. Since it is connected to a restroom behavior that appears to have no bearing on the health of the heart at all, the term nocturia is used to describe the condition of having to urinate more often at night than during the day. Although there are a lot of people who believe that this is caused by aging, an enlarged prostate, or drinking fluids before going to bed, it is possible that it is actually a subtle early indicator of heart failure. While you are in an upright position and active during the day, gravity causes fluids to build in your lower extremities. Due to the fact that your heart is not functioning at its full capacity, it is unable to pump this collected fluid back to your kidneys for proper process. On the other hand, when you lie down at night, the force of gravity assists in the redistribution of this collected fluid back into your general circulation, which causes your kidneys to become unexpectedly flooded with fluid that they were unable to process during the day. Your kidneys respond to this flood that occurs throughout the night by working hard to get rid of the excess fluid. As a consequence, the amount of urine produced during the nighttime hours is significantly high. Nocturia, which is defined as the need to urinate during the night, is one of the earliest signals of heart failure that may be detected according to research that has been published in cardiology journals. In some cases, nocturia can arise months before more evident symptoms such as shortness of breath or visual swelling become apparent. Patients frequently say that they wake up 3 to 5 times per night in order to urinate and that each of these episodes is accompanied by the production of an unusually high volume of urine. This pattern is very important, since it is indicative of your heart's failure to effectively manage the distribution and processing of fluids over a 24-hour cycle, which is what would be considered a normal function. Disturbances in sleep are a symptom that is listed as the 8th warning sign, and it is frequently attributed to a variety of causes with the exception of heart problems. The cough is one that is chronic and it tends to occur most frequently while the person is lying down or at night. This is neither the dry cough that is linked with allergies, nor is it the productive cough that is associated with respiratory infections. People frequently refer to it as a persistent dry cough that keeps them from sleeping. It also seems to alleviate while they are sitting upright. Orthopnea and this cough that occurs at night are both caused by the same physiological process. When you are lying down, fluid that has built up in your body over the course of the day as a result of your daily activities redistributes itself. This can lead to a minor accumulation of fluid in your lung tissue. Coughing is the normal response of your respiratory system when it detects what it believes to be a blockage or irritation in your airways, and it is an attempt to remove the irritant or obstruction. This cough is described in medical literature as being normally more severe during the wee hours of the morning, and it is occasionally accompanied by a faint wheezing or whistling sound. On a regular basis, patients report that the cough produces little to no sputum or that it occasionally comes up frothy mucus that is pink or white in color. These are both unequivocal indicators that fluid is in fact present in the lung tissue. The fact that it is so simple to incorrectly assign the symptom is what makes it so especially misleading. Individuals attribute it to allergies, post-nasal drip, dry air, or the conditions in which they sleep. They attempt to resolve their sleep disturbances by switching pillows, using humidifiers, or using cough suppressants, but they never consider the possibility that their heart could be the root cause of the problem. Dealing with the rhythm of your heart is signs and 9-10, palpitations and dizziness, fluttering, skipping beats at rest, lightheadedness, fainting on standing, reduced brain blood flow. The subject of warning sign number 9, which can be an important resource for providing early warnings about the possibility of heart failure in the future. When you are in the early stages of heart failure, your heart begins to work harder and harder in order to adequately pump blood throughout your entire body. As a result, you may experience palpitations, which are sensations that feel like your heart is fluttering, beating, or skipping beats. As your heart muscle becomes weaker, it frequently experiences difficulty in maintaining sufficient blood flow, which causes it to develop irregular beats. It is possible that you will get the feeling that your heart is beating very rapidly, even when you are perfectly relaxed, or that you will have the disconcerting impression that your heart is missing beats or that it is doing somersaults inside of your chest. There are individuals who describe the sensation of feeling as though their hearts are attempting to escape their bodies. According to research conducted at major cardiology institutions, there exists a bisectional association between heart failure and cardiac arrhythmias, especially atrial fibrillation. Cardiac failure can result from irregular cardiac rhythms, and heart failure can cause arrhythmias that are potentially life-threatening. This results in a cycle that is potentially harmful and that can quickly deteriorate if it is not detected and treated in a timely manner. Palpitations are typically most evident while a person is resting or lying down, and they may be accompanied by feelings of worry, restlessness, or a general sensation of unease. Palpitations can be brought on by a variety of factors, but if they occur in conjunction with other potential symptoms of heart failure, they should be evaluated in detail by a cardiologist in order to eliminate the possibility of serious underlying issues. The 10th warning sign might be very disturbing because it has an effect on your sense of balance and your brain. Many people ascribe the symptoms of dizziness, lightheadedness, or near-fainting episodes to a variety of factors when in fact, they can be early warning signs of heart failure. The reason you experience these symptoms is that your heart has become weak and is unable to pump enough amount of blood to sustain the blood flow to your brain that is necessary. This is particularly true when you are engaging in physical activity or when you are changing position. Your cardiovascular system typically responds to instances in which you stand up suddenly or engage in physical activity by raising your heart rate and altering the tone of your blood vessels. These actions are carried out in order to keep your blood pressure at a steady level. Nonetheless, if your heart is not functioning properly, it will not be able to make these crucial modifications effectively. This can result in temporary but large decreases in the amount of blood flowing to your brain, which can cause you to experience dizzy or lightheadedness. Clinical investigations have shown that roughly 20% of heart failure patients experience fainting episodes. These episodes can sometimes occur months before other more evident symptoms manifest, making them an early warning sign of heart failure. Quick movement standing for long periods of time or light physical activity that would not have previously had any effect on you are common triggers for these episodes. Misattribution is what makes this symptom especially worrisome in comparison to other. Dehydration, adverse reactions to medications, difficulties with the inner ear and low blood sugar are all common causes of dizziness that people frequently point to as the culprit. Dizziness, when experienced in conjunction with other possible signs of heart failure, indicates a significant reduction in your heart's capacity to pump blood efficiently, even though these illnesses can undoubtedly produce comparable symptoms. Signs and 11 to 13 GI issues, endopnea and cold extremities, nausea, fullness after small meals, breathless bending over, cold hands, feet, narrow pulse pressure. Although warning sign number 11 may appear to be entirely unrelated to cardiovascular health, stomach issues can be significant early markers of the development of heart failure. If following the consumption of just a small amount of food, you find yourself experiencing a persistent feeling of discomfort or fullness, a decrease in your appetite or abdominal bloat, these symptoms could be indicative of a problem in your circulatory system that is having an impact on your digestion. In addition to impacting the muscle of your heart, heart failure has an effect on your entire circulatory system, including the flow of blood to your gastrointestinal tract. This is the reason why these symptoms arise. When your heart is unable to pump blood adequately, the amount of blood that flows to your digestive organs is drastically reduced. In addition, fluid may build up in the cavity of your abdomen and your liver may get congested with blood that is not being circulated through your system as efficiently as it should be. As a result, a series of digestive issues ensue, which can have a significant influence on your quality of life and nutritional status. It has been demonstrated through research that these gastrointestinal symptoms are often disregarded by both patients and healthcare practitioners, due to the fact that they appear to have no connection to cardiac problems. This results in delays in diagnosis and treatment following the consumption of only a few bites of food. Patients who are experiencing these symptoms have reported feeling uncomfortably full, having a continuous feeling of nausea without any obvious explanation, or experiencing a prolonged feeling of bloating that does not go away with the use of conventional therapies for digestive issues. Heart failure can cause the liver to become congested, which can result in pain or pressure in the upper right quadrant of your abdomen. Of all of the early warning signals of heart failure, the 12th one is the most revealing. However, it is so particular that the majority of people are unaware of its existence. Endopnea is the name given to the phenomenon of experiencing shortness of breath within 30 seconds of bending forward. This occurs while you are in the process of tying your shoes, when you are picking something up off the floor, when you are bending over a sink, or when you are bending down for any other purpose.
The first documentation of bendopnea in medical literature occurred in the year. Studies that have been conducted since then have demonstrated that it is an extremely specific sign of increased pressures within the heart. The pressure inside your abdominal cavity is elevated when you lean forward. This rise in pressure causes your diaphragm to be pushed upon, which in turn causes a temporary increase in pressure in your chest cavity. If you are already experiencing difficulties with your heart due to high filling pressures, this additional mechanical stress might soon cause you to develop shortness of breath, which can feel rather worrisome. According to research published in major cardiology publications, almost 30% of patients with heart failure experience bendopnea, which is significantly associated with more advanced illness and an increased risk of catastrophic consequences. Researchers consider the symptom to be a non-invasive method of evaluating pressures on the heart. This is because the symptom is so dependable in terms of diagnosis that it eliminates the need for intrusive testing techniques. The specificity of bendopnea is what makes it especially important for early detection of the condition. This symptom is rarely seen by those who are in good health, which means that it is a warning sign that requires prompt medical intervention. Alterations to your circulation, which you may be able to detect in your hands and feet, are the subject of the 13th warning sign. The possibility that your heart is not pumping with adequate force to maintain proper circulation throughout your body is indicated by the continual feeling of coldness in your hands and feet, even when the weather is warm, as well as by variations in your pulse pressure.
Your cardiovascular system will immediately reduce circulation to your extremities in the event that you develop heart failure, since it will prioritize blood flow to the organs that are essential to your survival, such as your brain and heart. As a result, the hands and feet are constantly cold, and there may be a bluish discoloration of the lips or fingernails. In certain cases, it is possible that you will see that your hands and feet remain cold to the touch even when you are feeling warm, or that it takes them considerably more time than it normally would to warm up. The detection of narrow pulse pressure, which is a more modest indicator, requires that blood pressure be monitored. It is customary for the difference between your systolic and diastolic blood pressure measurements to be at least 40. When this gap becomes considerably smaller, it may be a symptom of a decrease in stroke volume. This means that your heart is not pumping out enough blood volume with each heartbeat, which can lead to serious health problems. According to medical studies, these changes in circulation frequently occur over time and can be considered early warning signs of diminished cardiac output before symptoms that are more readily evident begin to manifest themselves. The changes that are occurring in your body are a result of its effort to maintain circulation to the organs that are essential for survival, even if it means sacrificing comfort and function in your extremity. Action plan: track symptoms, weigh daily, see doctor for tests. Early intervention prevents 90% crises. Comment your sign and subscribe for tips. If you have identified yourself in any of these 13 cautionary indicators, please do not be alarmed, but it is equally vital that you do not disregard the signals that your body is sending you. If heart failure is identified in its early stages, it is completely possible to control the problem by making changes to one's lifestyle and seeking appropriate medical attention. It is essential to be able to recognize these subtle signals that your cardiovascular system is giving and to take proper action before a medical emergency occurs. The most important thing to keep in mind is that these symptoms frequently develop so gradually that it is simple to disregard them or attribute them to factors such as stress, a lack of physical fitness, or the natural aging process. On the other hand, if you start to experience a number of symptoms at the same time, or if activities that used to be simple become surprisingly challenging, then there is a good chance that your heart is attempting to convey something essential regarding its health. If heart failure is detected and treated early on, it can have a significant positive impact on your quality of life and long-term prognosis. There are a wide range of resources available in modern cardiovascular medicine to assist in the efficient management of heart failure. These resources include drugs that can strengthen the muscles of your heart, as well as lifestyle modifications that can halt or even reverse the progression of the condition. Your heart will be able to pump more efficiently. You will have a reduction in fluid retention, and your energy levels will be higher if you take advantage of the drugs that are available today. Changes in lifestyle, such as modifications to one's diet, the implementation of exercise programs that are appropriate for the individual, and weight management, can have a significant impact on the symptoms and progression of heart failure. Since we all grow when we share, we would appreciate it if you would tell us what you learned today and what changes you are willing to make in the comments section below. We can all help each other. If this video was beneficial to you, or if it even slightly changed your perspective, please click the like button. To ensure that you do not miss out on any information that could potentially affect your health, click subscribe. Before you leave, please do not forget to turn on the bell. Please enter 1 if this video was useful, and if it was not, enter 0. You might not realize how important your comment is. Keep in mind that your heart has been functioning continuously throughout your whole life without you ever having to give it a second thought. The moment that it begins to transmit these warning signals, it is imperative that you give it your immediate attention and respect. Do not wait until you experience extreme symptoms or until an emergency scenario arises before you seek assistance. We ask that you kindly consider sharing this information with family members and friends who could benefit from being aware of these early warning signals if you find this information to be useful and potentially life-saving. Early diagnosis saves lives, and you have the potential to assist someone in avoiding a cardiac emergency that may have been prevented. It is important to keep in mind that this material is provided for educational purposes only and should not be considered a substitute for professional medical advice. If you are having any of these symptoms, particularly if more than one of them are occurring concurrently, you should get medical attention from your healthcare provider as soon as possible so that you can be properly evaluated and treated. We appreciate you taking the time to familiarize yourself with these essential warning signs and for actively participating in the protection of your cardiovascular health. Your heart works around the clock every day to keep you alive and healthy. Therefore, it is essential to be aware of when your heart requires assistance, as this is one of the most important things you can do for your long-term health and well-being.